Hi everyone. The physicians at MedEd in Motion understand that difficult times are ahead, and many of you are worried about how this pandemic could affect both you and your family. In this video, we will go through some of the most commonly asked questions regarding the COVID-19 virus. I don't have any flu-like symptoms, but I'd like to go to the emergency room to get tested. Please do not come just for testing, as the emergency department should only be used to treat the acutely ill. Moreover, it is unlikely that you have the virus, as over 90% of infected patients will develop fevers and cough. By coming to the emergency department, you are increasing your risk of exposure, as there might be patients in the waiting room with active disease. My symptoms are mild or improving. I'd like to come to the emergency room to get tested. Please do not come to the emergency department if your symptoms are mild or improving. Even if you test positive, your physician will likely be sending you home. There is no well-studied outpatient treatment for the COVID-19 virus. Just like most other viruses, it is treated supportively, which means that you need rest and time to recover. You need to self-quarantine for at least 14 days. Take acetaminophen, also known as Tylenol, for fever, and ensure that you get adequate rest. Where else can I get tested for the COVID-19 virus? Testing sites vary depending on where you live. In some states, testing may be offered through urgent care centers, primary care offices, and even drive-through testing. Please call ahead if you are unsure whether a particular site offers testing. Remember, the emergency department is a treatment site, not a testing site. We cannot accommodate everyone who wants to be tested and will get overwhelmed as a result. What kind of symptoms warrant a trip to the emergency room? You should go to the emergency department if you develop severe shortness of breath. This should feel like you are unable to catch your breath even though you are merely walking from one end of your house to another. If you are concerned that your symptoms are worsening, talk with your primary care physician or call the emergency department and speak with a provider before making the trip. Someone told me that I can take a particular medicine to treat or prevent the COVID-19 infection. Please do not attempt to self-medicate without first discussing it with your physician. At present, there is no approved outpatient treatment for COVID-19. We are aware that certain drugs have been touted on social media as the cure to the novel coronavirus. These drugs have very dangerous side effects, and without proper instruction or close monitoring, they can result in death. How can I help? The best way you can help is by staying home. If you leave your home for essential items, wear a mask and wash your hands frequently. If you are able to, donate personal protective equipment to your local hospital. Will the emergency department still see patients with other complaints? I'm scared to go to the hospital because I don't want to get exposed to the COVID-19 virus. Yes, hospitals have set up systems to minimize patients' exposure to the COVID-19 virus. If you feel you have any emergency, don't wait. We will do our best to care for you and protect you. Lastly, we want you to know that we deeply appreciate your care and concern in maintaining social distancing and staying home. Not only does this help reduce risk to you and your loved ones, but it also lowers our exposure to the virus and helps us return healthy to our families. Stay positive, be well, and we will get through this together.